A cold sore, also known as a fever blister, is a small, painful blister that typically appears on or around the lips and mouth. It is caused by the herpes simplex virus HSV, most commonly HSV1, though HSV2, typically associated with genital herpes, can also cause cold sores. Once someone is infected with the virus, it remains in the body and can't reactivate later, leading to recurrent cold sores. Causes and transmission: cold sores are caused by the herpes simplex virus HSV1, which spreads through direct contact with an infected person. The virus is highly contagious and can be transmitted through kissing, sharing utensils, or other close personal contact, especially during an outbreak when sores are present. Exposure to saliva, sharing drinks, lip balms, razors, or towels with an infected person can transmit the virus. Touching the cold sore and then touching other parts of the body, including the eyes or genital areas, can spread the virus. Once the virus enters the body, it may remain dormant in nerve cells and can be reactivated by certain triggers. Triggers for reactivation: several factors can trigger cold sore outbreaks in people who carry the virus. Stress. Physical or emotional stress can weaken the immune system, allowing the virus to reactivate. Illness or fever, colds, the flu, or other infections can trigger an outbreak, hence the name cold sore. Sunlight and UV exposure. Prolonged sun exposure can lead to cold sores, particularly on the lips. Hormonal changes. Changes in hormone levels, such as those associated with menstruation or pregnancy, can trigger an outbreak. Fatigue, lack of sleep or exhaustion can lower the immune system's defenses and trigger a sore. Injury to the lips or mouth, cuts, dental work, or even chapped lips can cause the virus to reactivate. Symptoms: cold sores typically go through several stages during an outbreak. Tingling and itching. The first sign of a cold sore is often a tingling, itching, or burning sensation around the lips or mouth, signaling that the virus is active. Blisters. Within a day or two, small, fluid-filled blisters appear around the affected area, usually on or near the lips. Weeping and oozing. The blisters may break open and ooze fluid, forming painful sores. Crusting and healing. The sores eventually crust over and form a scab. As they heal, the scab may crack or peel. Full healing can take 7 to 10 days. Diagnosis: cold sores are typically diagnosed based on their appearance and symptoms. In most cases, no specific tests are needed. However, in uncertain cases or if complications arise, a healthcare provider may take a swab of the blister to test for the herpes virus HSV1 or HSV2. Conduct blood tests to detect HSV antibodies if a patient has recurrent or severe outbreaks. Treatment: there is no cure for HSV, but treatments can help manage the symptoms, speed healing, and reduce the frequency of outbreaks. Antiviral medications. These can be taken orally or applied topically to reduce the severity and duration of an outbreak. Common antiviral medications include acyclovir, valacyclovir, famciclovir. These medications are most effective when taken at the first sign of a cold sore, tingling or itching phase. Topical creams and ointments. Over-the-counter OTC creams like Decas and Abiraviate can help reduce the duration of the outbreak if applied early. Pain relief. OTC pain relievers, such as ibuprofen or acetaminophen, can help reduce discomfort. Applying cold compresses can also relieve pain and reduce swelling. Moisturizing. Using lip balms or moisturizers can help prevent the lips from cracking and aid in the healing process. Prevention. While there's no way to completely prevent cold sores if you carry the HSV-1 virus, several strategies can help reduce the frequency of outbreaks and prevent spreading the virus to others. Avoid triggers. Managing stress, using sunscreen on the lips, and maintaining the healthy lifestyle can help reduce outbreaks. Don't share personal items. Avoid sharing drinks, utensils, towels, or lip products during an outbreak. Wash hands regularly. Good hygiene can help prevent the spread of the virus to other parts of your body or to others. Avoid kissing or close contact during an active outbreak, especially with infants or individuals with weakened immune systems. Use antiviral medication. For people with frequent or severe outbreaks, doctors may prescribe suppressive therapy with antiviral medications to prevent recurrent cold sores. Complications. In most cases, cold sores heal without complications. However, in some situations, cold sores can lead to more serious issues, especially in people with weakened immune systems. Herpetic keratitis. The virus can spread to the eye, causing herpes keratitis, which can lead to scarring or vision loss if untreated. Eczema herpeticum. Individuals with eczema or atopic dermatitis may develop a widespread herpes infection if exposed to HSV. Herpes encephalitis. The rare but serious complication where the herpes virus infects the brain, potentially causing neurological damage. Infections in people with weakened immune systems. Individuals with HIV, those undergoing chemotherapy, or organ transplant recipients may experience more severe outbreaks or complications. Prognosis. Cold sores are generally a mild condition and resolve on their own. Most people with HSV-1 experience outbreaks less frequently over time. While there's no cure, proper management can minimize the impact of the virus on daily life.